big country that has billions, and most people when they take it's just trying to see its country prosper. I'm not judging that. At the end of the day, who's getting so that money's waste? I don't know. Welcome back to the podcast. If you haven't listened to any of our previous episodes, please go and check them out now. Today I'm going to be talking about basically medication and treatment in terms of lupus. So this is going to be part of the Living With Lupus series. If you don't know already, I have lupus, and I'm just going to talk about my experience with the medication and just any advice that I would give. So with lupus, it's hard to explain, but there's basically no medication really that's on the market that has been specifically made to treat lupus. The history behind it, like most of the drugs, for example, quinoric or hydroxychloroquine, that is a tablet that can be used to treat malaria. Like similar chemicals are used to treat malaria, and in the past people realized that, okay, this tablet works with my lupus patients, so let me use it on my lupus patients. The same with one of the other ones I'm taking, which is called mycophenolate, that is used for people with who have organ transplants. So weakens your immune system and stuff like that. So I'm going to start off with the two main medicines that you would get. So usually when you're first diagnosed with lupus, there's 2 tablets that they'll give you. The first being mycophenolate, the second hydroxychloroquine. So with the hydroxychloroquine, it's usually a white tablet, not too big, and it tastes horrible. Like, it's hard to describe how the taste of it, but it's really bitter, so just be prepared for that. I think you can get tablets that have coating on it, but I don't know if it helps. I haven't tried it, so just be prepared for that. But in terms of side effects, I haven't really had any side effects from it. But one thing that doctors often mention is it can affect your eyesight. So usually when you're on it, because usually lupus patients, that's the main thing that we're on. So we're on it for multiple years. So usually a doctor will tell you, okay, you need to see an ophthalmologist annually or after a few years or something like that, because it's not common. Like for me, I don't think this has been a problem, but it can affect your eyesight after taking it for a long period of time. So if your doctor hasn't mentioned anything about that or hasn't said that it could be a side effect, just ask them about it, because yes, it's not common for it to damage your eyes, but you don't want to be the person that ends up having their eyes damaged because of it. So ask them about that. And the second medicine, mycophenolate, so it's usually a purple pill or like a red and white, like those typical cartoon medication type things. It might look like that. It might look like a capsule or a tablet. It's bigger than the hydroxychloroquine. So one thing I need to mention as well though is that with the hydroxychloroquine, it can be difficult to digest. Like it can almost make your food digest quicker in your stomach. So once you take it, you might feel like your stomach rumbling a bit. So don't eat it. Don't take any medication on an empty stomach, for one. But also, if you're finding that taking the tablet it's not great for your stomach, try and dissolve it in water and drink it, or put it in juice or something, because that, for me, that's really helps, like with my digestion and stuff. It hasn't been too hard on my stomach when I'm taking it. So But anyway, back to the mycophenolate. So yeah, so it's either a red and blue capsule or purple tablet. I haven't seen anything. I haven't seen any other looking tablets. I don't know. And it's an immunosuppressant, which is different to the hydroxychloroquine. Hydroxychloroquine is not an immunosuppressant, but the mycophenolate is. And what that means is just that it suppresses your immune system. So when you're on it, you need to be careful of, just being super like hygienic, not overly like obsessive with it, but make sure whenever you're going out and coming back, you're washing your hands before you eat. You wash your hands, like make sure that you always have antibacterial gel on you and stuff like that. Because of the weakened immune system, a lot of doctors will tell you, you need to be vaccinated. Make sure you're vaccinated because you're so vulnerable to outside diseases because you're on this immunosuppressant. For me, personally, the last time I had a flu vaccine, I had the worst lupus flare of my life. So that's just me. So I don't know if I'm going to have that flu vaccine again. I don't know. But if you feel like you can't have the vaccine, that's fine. Talk to your doctor about it. If your doctor says, you know what, it's your choice, that's fine. Just try and get the people around you vaccinated at least, like your family, whoever you're living with. So at least that way you're less likely to be prone to a disease or be prone to the flu, even if you don't get vaccinated, because the people around you won't have it. So yeah, with the mycophenolate, I don't know about side effects. I think over time, because your immune system is so suppressed, it can obviously make you a bit weaker. Like I felt that because last year I was on quite a high amount, so I was on 1.5 grams twice a day. So in terms of tablets, that was about 3.5 twice a day, I think. Yeah, about 3.5 twice a day. So yeah, over time you might feel like a loss of appetite. Like I'm reading this on Google. A loss of appetite, nausea, vomiting, headache, stomach pain. So you just might feel a bit just off, like, and that's okay. But if it's getting too much, which for me it got to a point where my body was basically rejecting it. Like I think it was the dosage was just too high for me. So if it's getting too much, talk to your doctor. Obviously, they can change dosages and stuff according to you. So don't be like worried to talk to your doctor if you think, yes, he said it or she said that this medication is going to work, but it's making me feel like this, it's making me feel like that. Speak up, because this is one thing that I've learned is that patients are the center of the NHS. Like there's no NHS, there's no hospital without the patient. So as much as it's up to the doctors and staff to make sure that they're focusing on patients and taking care of patients, it's also up to us as patients to say when there's a problem, to say when something's wrong. Like that's the only way healthcare will develop and grow, and that's the only way people learn. If you say something, even though it might seem a bit, oh, I'm not a doctor, how can I tell this doctor that what I think he's doing isn't right for me? Don't feel like that, because we're all different. Like we're not human bodies in a textbook. It's not like each of us need the same treatment, we have the same needs, we need the same things. It's not like that. So yeah, one thing to please take away from this, even if you don't have lupus, like talk to your doctors. If you feel like there's something wrong, or they tell you something and you still feel like the issue's there, just tell them. You're not being annoying, you're just being a patient. But yeah, apart from that, in terms of mycophenolate, I don't think there's any other side effects. Yeah, so those are the two main ones that you'd get. So I haven't been on every single medication, but another one that I've been on is azathioprine or azathioprine. I don't know how to say it, but yeah, that's just another lupus medication. I wasn't on it for too long. I was on it for... So basically last year I stopped with the mycophenolate for a bit. Then I was on azathioprine for a few months. So I was on that for a bit. When I was on it, I didn't take the tablet, so I took it in liquid form. Yeah, because for me liquid form just works. But I don't think I got any severe side effects. But side effects that they often mention is like skin rash, loss of appetite, like the mycophenolate. I think I might have had that a bit. You might get a bit of like vomiting, a bit of nausea, upset stomach. I didn't have that, so I can't really speak on that. But if you do feel that, again, go to your doctor, ask them what's going on. I think with the liquid medication, sometimes the NHS are a bit stingy with it. Like, it's not their fault, obviously. They have a budget, they need to stick to it. So if you do ask for... I know some doctors aren't understanding, like, in a sense that some people actually can't take tablets, like their throat just won't allow it. And that's even if you're an adult, not just for children. So if you make sure you ask for what you need. If you need liquid medication, ask for it. But if you ask for it and they don't give it to you, just ask them, can I dissolve it in water? Usually you can, like, because you're going to take this with water anyway. So dissolve it in water, dissolve it in juice, and take it like that if it works for you. Yeah, so azathioprine, like, yeah, there's nothing much I can say in terms of that. On Google, it says that it may increase your risk of developing certain types of cancer, like skin cancer. I can understand that because I guess it is weakening your skin slightly, but don't get too worked up about that. Talk to your doctor. Another one that I'm going to talk about is rituximab. Now, rituximab is different because it's not a tablet. It's what you call like an intravenous liquid that they'll give you. So I had rituximab treatment last year in May or June time because basically I was just having a flare up, and my doctor just said, you know what, maybe this treatment will work for you. So yeah, so the rituximab, they stick like a tube into your arm, and they'll give you the rituximab as a drip. You usually have to go into hospital twice for that because it's a cycle. Like, you need 2 cycles of it. So they can either do, you stay in for 2 days and you have it over 2 days, or you can come in once and then come in again. But yeah, so when I had it, I think the first course I had was, I was in hospital for 2 days because I was having a biopsy and the first course. But if I didn't have the biopsy, I would have just come in one day, then 2 weeks after, come in again to get it done. So yeah, rituximab is obviously scary, like, especially if you haven't had that hospital experience before, going in, someone sticking a liquid into your arm. But it's not as scary as you think. Just make sure when you have it, have something to do, like have something to read, have something to watch, because it can get a bit boring because you need your arm to be in that same position. So it's not like you're going to be doing anything fun, really. Like, it's not like you can be writing and stuff, because then the cannula and stuff will move. You might feel, I definitely felt this, you might feel itching when when it's being like put through your vein. Maybe it's because any liquid going through your vein is itchy, but for me, I felt that itchiness a bit more, like on my skin, on my arms where it was being put in. Yeah. So because rituximab is a bit stronger than the average tablets that you take every day, like it's much stronger. There's I'd say more side effects to it. So here it says some of the side effects are headaches, fevers, chills, stomach pain, dizziness, heartburn, night sweats, weakness. So a lot of these side effects, I felt them, especially the heartburn. Like I never before that I didn't. When I heard heartburn, all I could think of was pregnancy. I didn't know what heartburn was. I just knew that when people were pregnant, they could feel the baby's hair and they'd get heartburn. But I felt that heartburn when I had rituximab. So don't worry too much. Obviously, if it's getting too much for you, then talk to the doctor. But if you do feel it, like, it's a side effect. Night sweats, yeah, I felt that, like, just being hot, waking up sweaty for no reason. But it didn't disturb my sleep. It's not like I had insomnia or anything, but just uncomfortable sleep. Weakness, yeah, I had a bit of that. Like, at school, I had to use a suitcase instead of a backpack. Not only because of the kidney biopsy I had, but just in general, my body wasn't. I was just weak, so yeah, I needed that. Diarrhea, I didn't really feel that. Nausea and headaches, I felt that a bit. Just because it is such a strong, like, I feel like there's headaches and then there's medication headaches, like when you feel like something's in your blood is just too strong, like that type of feeling. I feel like in general when you're on medication, just it's sad, but like expect to feel that. Like I have a lot of headaches sometimes because of my medicine. Like I can't take it all in one go. I need to spread it out. So yeah, just expect to feel that. Just make sure you keep hydrated, make sure you're sleeping well, and obviously if anything gets too much, talk to your doctor. Yeah, I think that's about it in terms of the side effects. You can get dizziness and back pain, joint pain, but if you have lupus, you probably already have pain anyway, so it doesn't make much of a difference. But one thing I would say is that I think just be aware that doctors, yes, they know things, but they are trying out new things with you. Like a lot of things are an experiment, especially with lupus, because you can be on multiple medications and different combinations work for different people. Sometimes your doctor might try something out and it won't work. Sometimes he'll try it out and it works. Like for me, mycophenolate and hydroxychloroquine, I've been on that for about 5 years. Like for me, that's worked. But at the time when I had rituximab, I was on rituximab, hydroxychloroquine and mycophenolate. And after a while, like I remember having a rituximab in Mayish, but in August, that's when, I don't know what it was, but my body just couldn't cope for a number of reasons. But I think one of the reasons being the medication and the mix of the medication. Like I was even talking to my mum about it, like just thinking about the timeline of events, like what happened, and we came to the conclusion that maybe the combination of rituximab and mycophenolate was just too much for me. So yeah, so don't be, obviously it's frustrating, like no one wants the doctor to tell them that something's going to help them and it just makes them feel worse. No one wants that. The doctor doesn't want that. But just be aware that if you feel, this, every time I take this medicine I have a headache, like every time I take this medicine I feel like vomiting, or I keep getting rashes, this is not for me. Just go to your doctor and ask them, is there anything you can do about this? Because they don't want you to be suffering just so you can be on the medicine that they think is right. They don't want that either. So yeah, that's the main thing. Another medicine I think more common is prednisone, or steroids, as most people call them. This medication, I think I have like a love-hate relationship with this medication, because one thing, like, a lot of the medication that I've previously mentioned, a lot of them take a while to start working. I feel like the mycophenolate, a month, you need a few weeks to feel the difference. The same with the hydroxychloroquine. The rituximab, I think after a few weeks as well, you'll feel the difference. But with the prednisolone, it's about a few days even that you'll feel the difference, which is why often when you have a flare, or like your lupus is just a bit uncontrollable, that's the first thing they might put you on. Because I think that was one of the first things I was put on, because it's so fast acting. Basically, it can control the disaster that's happening. So it's a steroid, usually in tablets, but you can get steroid injections. So you go in, get an injection every few months. So talk to your doctor. If that's for you, then that's for you. It can be used to treat a lot of things, actually, like not just lupus, infections, allergies. Like, because I have a bit of eczema, in a lot of eczema creams they'll have that steroid in it, so to help your skin and stuff. So it's a great medicine, but I think this is the one medication that has the most side effects. So so one of the typical side effects is moon face or swelling. Like, so the prednisolone can cause a lot of water retention. So when you start taking it, you will put on weight. You will see the numbers on the scale increase. Like, there's no doubt about that. That's the main side effect that most people have. You might see your cheeks getting much bigger, wider, having a chubby moon face. Don't get too worried about that. But it can also give you like an appetite, like you feel like eating a lot. But I feel like that side effect kind of dies down the longer you're on it. So the first time I was on it, I had that for a few weeks. But the second time they put me on it, I didn't really feel that need to eat that much. So just get used to it. Just if you just kind of monitor yourself. Like, if you find yourself thinking, you know what, I've eaten 4 meals today, but I usually eat 3, then, and you're on the steroids, then start just monitoring yourself. Just be like, okay, next time I won't eat that. But another thing with the steroids, I don't think it's not as common, but for me, I felt this one, is the mood swings and the kind of emotional effects. Because I'm not a scientist, but the steroids have a chemical in it that is usually associated to, like, your body's, I think it's cortisol, I don't know if I'm right, but just your body's ability to feel happy, to feel good. And it can, after long periods of time being on it, sometimes your body can find it difficult to produce that same chemical. So I think that's why it causes mood swings. I'm not sure, but for me, I felt that a bit, like that type of depressed feeling. Like, yes, some people get mood swings, like sometimes they're angry, but for me, like, I felt that irrational sadness, like literally nothing was going on, but I was feeling sad. So yeah, if you feel like that, don't panic, obviously, but just note that. Talk to your doctor if you need to, but just note that. And whenever you feel like I give up, like feel like crying, just take time to sit down. Just think, okay, I'm on this medication. Like, just calm yourself down, because at the end of the day, it's not, you don't feel sad. It's the medication making you feel sad. And that's okay. Just make sure that you take care of yourself. Another thing, I think long-term side effects is like muscle weakness. Okay, sometimes it'll be like severe mood swings, as I said. Acne. I think I get a bit of acne because of that. Eye problems as well. I don't think I've had eye problems because of that, but if you do, ask about it. But yeah, that's mainly it. Just the weight, the muscle weakness. I've had a lot of that. So it's difficult. Obviously, if you have lupus, you have chronic pain and chronic fatigue. So when people tell you to exercise, sometimes you just switch off your ears, like, what are you talking about, kind of thing. It was difficult me getting out of bed this morning and you're telling me to go to the gym. But exercise is important, because when you're on, especially when you're on steroids or any type of medication, you just need to make sure that you're keeping healthy as well. So I think for me, walking's the best. Yeah, because it's not harsh on my joints. It's stretching them. Like, I'm not running. Like, I find that running and going to just lifting heavy stuff is just not, it's not for me. So if you don't feel like that's for you, just try something different. Don't feel pressured into doing intense exercise, because your body just might not cope well with that, and that's okay. So yeah, I think that's about it. Obviously, there's the supplements that some doctors will give you. Like, they might give you vitamin D tablets and iron tablets. The only thing with iron tablets is that it might make your like poo darker if you're taking it if you're taking high amounts for your body, like, because when my iron was really low, I took them, but then eventually my iron, by eating good foods and stuff, my iron built up by itself, so I didn't need the supplements as much. I don't take the supplements now. One thing, supplements are good, like especially in the winter, because, well, if you live in London, like in England, there's not much sun, so vitamin D is hard to get. So it is good to have that supplement when you can, but over a long period of time, these supplements, they sort of make your body lazy. Like, your body will start to produce less vitamin D and iron because you're constantly giving it to yourself. Do you know what I mean? So obviously it's your choice. Like, this is your treatment. No one's forcing you to do anything. But I personally think it's better to not take the supplements and to eat well rather than to take the supplements, because then at least your body isn't too dependent on something else. Like, you'll already be on other medication. You don't want, or I wouldn't want more and more tablets. Like, it's better to just medicate yourself through your food rather than being prescribed more and more tablets and stuff. So one thing that I would say, just to take away from this, is that sometimes when you're on medication or when you're just having changes to your life, it can be difficult. Like, you can feel like your personality is kind of being stripped away from you. Like, especially when being on steroids, you look at your face every morning, it's getting bigger. You look at your weight, it's getting higher. You look at your hair, it could be falling out. And sometimes it can be difficult to wake up and like look at yourself, look at your skin, it looks different. Like sometimes it can be difficult. You feel like you don't even know yourself. You're a completely different person. With lupus or anything important or ongoing like that, it can make you feel like you don't know yourself and you don't know who you are, which is why it's so important to do things that not only keep your mind focused, but to do things that you love, to know that this is me. Like I like writing books, I like reading books, I like drawing. This is me. This is one thing that if I was in hospital, I can still do. You get what I mean? So try and find that thing that you always have. Like, I'm not saying don't dance, don't do sports, because that's a great thing to do. But obviously there will be times when you physically cannot do it. And that's okay. But just make sure you don't let that defeat you. Don't let the things you can't do define you. That's because the only thing that you're hurting is yourself by doing that. You're just crushing your potential and your happiness if you do that. So yeah, with the medication, I just say make sure you drink a lot of water. Make sure you talk to your doctors. Eat before you take the medication. If anything's wrong, if you feel anything different, make sure you note it down so like you can remember it afterwards. Like don't just brush things off because you think yeah, headache for no reason, it's all right. Like note it down because it might be something that keeps happening and you might have to sort out. But other than that, there's nothing else I have to say. Thank you for listening. If you want to contact us, please DM us, email us, tweet us, anything. If you want to be part of this series, please contact me, because obviously everyone's experience with anything is different, especially with lupus. So I don't want to just give my opinion on it. But yeah, if you want to be part of our Phone a Friend series, contact us as well. And thank you for listening. Big country that has billions, and most people when they take it, it's just trying to see its country. You're taking more than one, or you're taking it. At the end of the day, who's getting so that our money's wasted?